Hi, it's Dr. Spears. I want to welcome you guys to another MCAT Monday where we talk about pertinent and relevant things for you guys when you're preparing for your medical college admission test. And so I posted something earlier on social media, got some feedback, and then also got a lot of questions. One of the questions in particular was about resources that you should be using when you're preparing for the MCAT because, like any studious pre med student who's worried about time and really wants to do well on the exam, the student was inquiring about, I want to make sure I'm using the correct resources and I'm actually not wasting your time. So that's a really good question there. What are the top resources that you should be using? My biggest take on the MCAT and prepping for when it comes to resources is you want to make sure that you're not getting overwhelmed and using too many resources. So the first thing I want you to do, I want you to have a primary resource. This could either be a textbook series or a video course or even one of those classroom courses. Whatever you feel, that needs to be your main source of learning and preparing for the MCAT. Then you need a secondary source. That's going to be maybe a textbook, video series, or something else. But this isn't supposed to be very big, expansive secondary source. This is only if something's confusing with you in your primary source or you need to look up something because it's just not making sense for you. You want to have that backup resource available to you. And then the third thing that you absolutely need a question bank because the only way that you're going to improve on your MCAT score is by actually doing questions to get you ready for the MCAT. And I don't like to knock a lot of companies or anything like that, but what I'm hearing from a lot of students is they're telling me that I just took the MCAT and I was using the Kaplan series, their question banks, their materials, and I felt that it was just too involved, too detailed, and wasn't representative of the actual exam. And you know what? That's actually very surprising. Well, not surprising, but once you actually get into medical school, you're going to have to take your medical licensing exams, aka your boards, your steps, however you want to refer to it as. And so, obviously, there's going to be test prep companies that are going to make resources to help medical students pass their boards. And one of those companies is actually Kaplan. And what's surprising is that a lot of professors and people who help medical students prepare for their boards absolutely tells students to stay away from Kaplan. It's not representative of the test. It's too detailed oriented. And when you're taking a lot of your boards, it's really conceptual thinking because when you're a doctor, it can't be, oh, can I just memorize this and then do that? Absolutely not. Because when you see patients in the hospital, urgent care, and clinic, they're not going to present as a classic textbook case where if you just memorize things, you're going to absolutely be able to diagnose and treat that patient. That doesn't happen. You need to be able to think on your feet, be able to simulate a lot of information from your history and physical, and then come up with your differential diagnosis to adequately treat and have a treatment plan for your patient. And so, Kaplan, unfortunately, they're just not good at doing that for you. Usually tutors or somebody would say maybe you can do Kaplan while you're in your courses during med school, but once you're in your dedicated prep time for your boards, stay away from Kaplan. It's not going to be representative of what you need to do. So you're probably thinking, okay, Dr. Spear, you're telling me what I shouldn't use. What should I use? So I'm a big proponent of exam crackers. I think that's a good resource to use as well. And I people like videos, use those courses, Kaplan course, Princeton Review, Berkeley Review, Next Step Test Prep. They're also a good one out there as well. So you want to find something that works for you. But then when it really comes down to your question banks, here's the golden ticket to your success and getting ready for the MCAT. I have students tell me that, oh, they use the AAMC question banks for their practice tests. They were good, they were decent, they'll get the job done for you. However, what's new on the market in the last few years, and particularly for the MCAT actually, is something called UWorld. UWorld now has an MCAT question bank, and they're the gold standard. You ask any medical student, any resident in medicine, and they're going to tell you, we use UWorld. We use UWorld. That's what we use to prepare for our boards and everything. They are just top notch, and they're going to give you the knowledge and expertise to really excel on these board exams. So now that they're jumping into the MCAT, and after speaking to students who've actually taken the MCAT and have actually used UWorld, they're telling me that UWorld really mirrored what they had on the actual exam. So if you have questions, if you're concerned about what resource to use, the question bank that I highly recommend 100% would be to start using UWorld, because that's really going to give you that competitive edge, that advantage. That's going to help you to start seeing the test in a way that's actually going to mimic what you're going to see on test day. So if you have questions and you're trying to figure out, like, how can I improve my score, I think one of the best things you can do is actually start using UWorld to prepare, do practice problems, and just really put yourself in a good position to do well on the MCAT. And so what I want to say, a little bit disclaimer, I don't have a dog in this fight, as they say, or any skin in the game. I don't have any affiliate links for like the MCAT, AAMC, UWorld, or anything like that. However, I do have an MCAT Master Companion course that students have actually loved and enjoyed, and students have told me that they've been studying, they reached a plateau, they weren't seeing improvement in their scores, and then after going through the course, they actually jumped up 8 points. Imagine jumping up 8 points in your MCAT score. That's huge. That's significant. I don't even know how many percentiles that is, but that's going to really put you on the radar of a medical school. So I have my MCAT Master Companion course that's available. And I say companion course because you use it in conjunction with your MCAT study materials, because this is more test taking strategies, tips, and how to be more efficient, how to study better, how to prep better. Because my whole thing is you need to be efficient and you got to be very strategic in your use of your time. So I want you to study less, learn more, and score higher. That's my mantra with my MCAT Mastery Companion course, and it's just top of the notch. I'm always adding to it. Just have a lot of stuff that's being involved in that course to really see you guys excel on the MCAT, because that's the #1 factor that decides whether a pre-med student gets into medical school or not. It's going to be your MCAT score. So don't listen to anybody else who tells you anything else about that. I can go on a huge tangent, my thoughts about people with very subpar MCAT scores who get into medical school, and the misinformation, disinformation that goes out in regards to that. But you're in a position, you're in a driver's seat right now where you're absolutely 100% in control of the MCAT if you haven't taken it already, and you really need to dedicate your time and studying to it to do well on it, because it really can open doors for you for getting into medical school. And again, this is Dr. Spears with drpremed.com. So make sure you visit the website, check out all the things I have going on over there. And I want you to study wisely, do well, and excel on the MCAT so that you can have your choice when it comes to applying to medical schools and having actual multiple acceptances from medical schools by doing very well in the MCAT.